Tobacco use continues to be one of the single most preventable causes of disease and premature death in the United States. However, 34 million Americans continue to smoke cigarettes. To encourage smokers to kick the habit, each year the American Cancer Society marks the third Thursday of November for the Great American Smokeout. Smokers are urged to use the date to make a plan to quit. More than 16 million Americans live with a smoking-related disease. By quitting, even for one day, smokers will be taking an important step in avoiding asthma, lung cancer, and COPD. Ed Neuzil and Shannon Messner, both board-certified nurse practitioners at Allergy Sinus and Asthma Family Health Center, explain what COPD is and how it is treated.
COPD is typically caused by irritating substances, so a lot of our smokers will develop COPD.
COPD is actually a chronic obstructive pulmonary disease, so this is something that goes over a period of time, and it can include things like asthma, chronic bronchitis, emphysema, so it's kind of a cover term in the fact that a person's airway does not actually return to a normal state after we give them a bronchodilator.
There's two types of conditions that happen with COPD. It's the chronic bronchitis, so you'll have this cough that lasts for more than 3 months, and it's a productive cough because you have a lot of mucus production. And then the other part of COPD is the emphysema, so that really affects the smaller airways, which is the alveoli, where you are having difficulty doing the exchange between the oxygen and the CO2. When your alveoli are damaged, you're going to have a harder time breathing in the oxygen and breathing out the carbon dioxide.
A lot of times people don't understand. They think that what they have is normal. I talk with my patients and ask them if they're short of breath, do you do anything to get short of breath? Well, no, not really. Did you ever do anything, activities? Well, I used to play baseball, but I don't do it anymore. Well, why not? I just didn't enjoy it. Well, you know, if you played baseball and you got short of breath every time you played baseball, you ain't gonna play baseball no more. And they don't understand the fact that this may be a change in their health.
Lifestyle is a big factor, and we all want a good quality of life, and food becomes a big part of it. So as we're eating more, we should be exercising more. So activity is a big part of some of the problems that I see with the breathing.
COPD is a progressive disease that gets worse over time, and there is no cure. So you want to establish a diagnosis and treatment plan early so you can prevent it from getting worse. It can be very debilitating if not treated appropriately.
Nobody wants to have COPD, but the more they can understand about this disease, even before they have it, the more we can prevent the disease.
To get in touch with the specialists at the Allergy, Sinus, and Asthma Family Health Center, just click the Out of Breath story link icon on our homepage at yourhometownhealth.com.